Hello everyone and welcome to Module 9. This week our focus is going to be on the topic of patients with special needs and disabilities. Along with that, we'll be talking about how to handle patient education for certain types of patients with disabilities or maybe even just special needs. So with that, we are focusing on just one chapter, and that is going to be chapter 56, but it's only pages 1326 through 1332. So just those few pages will really focus on, again, the education and meeting patients' needs with education. So let's go ahead and get started talking about those few pages. So the first thing I want to kind of talk about is, what does the term special needs really mean? Because truthfully, shouldn't we treat all of our patients as though they are special and as though they are respected? And the answer to that is truly yes, we should. But the term special needs means that a patient might need extra help because of a medical, emotional, or learning problem. They may have special needs because they might need medicine, therapy, or extra help that other patients typically do not need or only need once in a while. This could include the use of patients needing wheelchairs, leg braces, transportation to and from the clinic. Maybe they have to have Braille literature because they are blind, or maybe they just have a visual impairment. Maybe they need speech therapy or the TTY communication devices. They could need long-term care services or even support. Long-term services and support for patients with disabilities can include both medical care and non-medical living care to assist with normal daily tasks, maybe things such as eating, dressing, and using the restroom. Some patients may need care that's provided at home as well as in the healthcare facilities like hospitals or long-term care facilities. Now, as a medical assistant, you need to ensure that your patients with disabilities receive information concerning benefits, services, rights, waivers of rights, or consents for treatment. In addition, you may need to let the family have additional support or inform them of additional support to assist with their loved ones. So with knowing this information, it's really important that you know that patient educations must be adapted to not only fit the learning style, but also the needs of your patient. With all special needs patients, you need to make sure that as the medical assistant, your patient understands the information. And the best way to do this is to ask for feedback after an education. That may be them telling you what they've learned, or maybe even them demonstrating what they learned from the teaching that you gave. So let's start our discussion on some specific patient educations for teaching different special needs. And the first one I want to kind of start with is talking about teaching children. So children education and children's needs are much different than that of adults. And the first important thing that is really should be noted is that you do not want to treat children as though they're tiny adults. Okay? They need to remember things and they need to do processes that are in their realm. And not talking to them like they're an adult. They don't know those things. Okay? You don't want to teach to them in a level that is beyond and above what they currently know. Children also may need to see a treatment or a procedure performed on a doll before having it done on themselves. And this is just to kind of help to alleviate some of that fear, okay? Maybe even allowing the children to touch the equipment because they like to touch things to learn from it. So if you've got the time, allow them to play with things like your stethoscope or the blood pressure cuff. Let them look at and maybe touch the thermometer. Let them play with the gauze or the bandages or the Coban or whatever it is that you're using with them. Allow them to kind of play with those things first, just to, again, help alleviate some of those fears. With children, the use of coloring books can be awesome for teaching. Having them have the ability to kind of see things and then maybe color them and draw them and make them come to life for the children is a good way to teach them. And stickers can really be given as a reward for maybe understanding something, or even just to help kind of provide positive energy for them. Now, as children do get older, they should be included in the discussions and the decisions about their own personal health. Okay, typically we say that children around age 13 are able to start really kind of making sound decisions, and at 17 they become emancipated minors, so they can actually make their own medical decisions at that point. In any case, it is extremely important that when you're providing educations for children, you direct the education to both the child and the caregiver. Do not ignore the fact that just because a child may not understand, that doesn't mean that they don't want to be talked to. They absolutely should be. Next patient teachings we have really fall into some special needs, and that is people with hearing impairments and visual impairments. Hearing impairments, so patients with those frequently do read lips, so you want to make sure that in those cases you typically face the patient and you speak slowly. You want to be sure that you do not stand with your back to a window or a light source, because what typically happens in those cases is there's a shadow cast upon your mouth, and it makes it difficult for the hearing impaired to read your lips if they cannot see your mouth. You also want to try to remove any barriers or face masks when speaking to patients with hearing impairments, again, so that way they can read your lips. And you may need to hire or use an interpreter for those that are deaf. Typically, we tell you not to use family members as interpreters, because not always is the information that you know correctly replied back to the patient or given from the patient to you if you're using family members as interpreters. In any situation with the hearing impaired, you always make sure that you provide detailed and specific written instructions for the patients. This may take a little bit more time than it would for any other patient, but in the end, it will be more beneficial for the patient with a hearing impairment if there are detailed step-by-step instructions. Visually impaired patients typically may not be able to read written instructions, maybe because they can't see at all or the font is too small. So for these patients, you may need to do what we call an audio recording of instructions that you normally would have written out for them. Maybe it's that they will be using their cell phones and recording patient educations, or you use a microphone and you speak into a recorder for them. If that is the case, when you're doing this, again, same kind of rules apply with the hearing impaired. You want to speak slowly so you don't rush through something, but also make sure that you enunciate all the highlighted points of an education. When you're working with a visually impaired patient, you want to make sure that your facility is clear of clutter in the hallways and in the exam rooms, so that way it doesn't impede that patient. And if needed, always ask them if they would like a guided arm to navigate into the exam room, but don't assume that they want that. Next kind of topic is dealing with developmental delays, mental challenges, illiteracies, and language barriers. So patients with developmental delays are those that are mentally challenged may have trouble understanding complex or multi-stepped educations and teachings. In these situations, you want to make sure that you give the instructions to the caregiver, maybe instead of the patient, but that does not mean that you should ignore your patient. They are still your patient. Look at them, talk to them still, but make sure that instructions are then also passed on to their caregiver. With patients who are illiterate, means that they cannot read or write. And honestly, they're not going to be very forthcoming with this information because they can be embarrassed by it. So make sure that you watch for behaviors to indicate that they are illiterate. Maybe it might be that they say they forgot their reading glasses, or they ask you to read something for them. It might even be that they ask you to help them fill out a form on their behalf. With this type of patient education, you have to get creative. Maybe it means that you draw pictures to help them understand things, because they will do better with drawings than they would a written word. And patients who do not speak English or maybe don't understand English, typically you'll know that information in advance, and you can prepare for this by setting up an interpreter. Again, not a good idea to use a family member, so you want to make sure that you use an interpreter that is provided by your facility. And it's important to make sure that if you have a patient who does not speak any English or doesn't understand the English language, that you make their patient educations in their native language. Now with the EHRs, it's much easier to do this because you can change the languages on patient instructions that we give. Final topic is talking about teaching older adults. So with older adults, their intellectual capacity does not diminish, it just merely changes. Things you have to look out for are slower processing time, which means you might have to break down the information into smaller units. And you also want to take as much time as needed to explain every item on the list. Don't skip over things just because you think they aren't important. Older adults could have decreased short-term memory, so they'll have an easier time to remember something from their past, but maybe struggle with things that they newly learn. This can get very frustrating not only for the patient, but maybe for you. So in those situations, if it's possible, try to link new information with something from their past. That will help it to stick better in their memory. They could have decreased dexterity. So what that really means is they have maybe a loss of the ability to use their hands effectively. This could be due to some physical change or from arthritis. And finally, they might have increased anxiety about new situations. So with older adults, many changes occur in their life. And as an advocate for the patient, you need to help them by encouraging them and building up their confidence. You'll want to make sure that you're more relaxed because that helps them feel relaxed and more at ease. And always, with any patient teaching, but especially those of the older adults, make sure you're practicing positive reinforcements and providing encouragements when they do learn something. That makes it, again, a more relaxed environment, and they feel a little bit easier about learning new situations. All right, so that is where I'm actually going to stop for the review this week. It is just a few pages, so please, again, make sure that you're reading those because there is some information I did not cover, but still very important for you to know. Now, this week you do have one case study. And what we're really looking at and focusing on is patient communication. So in this assignment and in this case study, you are presented with a scenario of an 82-year-old woman returning to her surgeon's office for follow-up care. What you need to do is you need to read through the scenario, and then there are 5 questions that you need to answer. Now, because your paper does need to be written in proper APA formatting, that means that you should be writing your answers in paragraph formation. That does not mean that you should be putting in question and answers into your assignment. Now, this assignment will be